Rahim. Verse of the day is, and whoever relies upon Allah, then he is sufficient for him. Indeed, Allah will accomplish his purpose. Allah has already set for everything a decreed extent. Assalamu alaikum, everyone. My name is Dr. Momina Zia, and I'm a PGR in Community Medicine Department at King Edward Medical University. And today I'm going to present the topic of disease surveillance under kind supervision of Professor Dr. Sairam. Learning outline of today's session will include introduction to public health, disease surveillance, principles of surveillance, various types of surveillance, disease surveillance cycle, importance of surveillance, disease surveillance systems, the challenges, and the role of technology, along with recent updates and multiple choice questions. And by the end of this presentation, participants will be able to understand and explain the surveillance systems and their importance in public health and various challenges faced during the surveillance process. What is public health? It is the practice of protecting and improving the health of families and communities through promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious disease. One of the practices in epidemiology includes disease surveillance. The core function of public health is assessment of disease, which also includes disease surveillance. Now, what is disease surveillance? It is defined as the ongoing systematic collection, analysis, and interpretation of health data essential to the planning, implementation, and evaluation of public health practice, closely integrated with the timely dissemination of these data to those who need to know. Surveillance may be carried out to monitor changes in disease frequency or to monitor changes in the levels of risk for specific diseases, monitoring disease patterns, detecting outbreaks, and guiding public health intervention. It is the primary method through which federal agencies in the US, such as EPA, which is the Environmental Protection Agency, identifies the contaminants of emerging concern. Now, it includes proactive monitoring, which shows that disease surveillance allows health authorities to proactively monitor the health of population and detect emerging issues early. It also includes a targeted response in which with timely data, public health officials can implement targeted interventions to control the spread of the disease. And evidence-based decisions are also included, which shows that surveillance data informs policy decisions and resource allocation to address the most pressing health concerns. Moving on to the epidemiological principles of disease surveillance, these include three. One is systematic data collection, two is timely analysis, three is population level insights. In systematic data collection, standardized reporting mechanisms ensure comprehensive and consistent data gathering across healthcare settings are included. In timely analysis, rapid processing and interpretation of surveillance data enables quick detection of trends and outbreaks of various diseases. However, in population level insights, aggregating data at the community, regional, and national levels reveals broader patterns and risk factors of those diseases. Moving on to types of surveillance, there are four major types of surveillance. One is passive surveillance, two is active surveillance, three syndromic surveillance, and four sentinel surveillance. We are going to see the definitions with examples of these different types in the coming slides. Number one, passive surveillance. It denotes a surveillance system in which available data on reportable diseases they are used or in which disease reporting is mandated or requested by the government or the local health authority with the responsibility for the reporting often falling on the healthcare provider or district health office. The examples of reportable disease include common sexually transmitted infections like syphilis, gonorrhea, HIV/AIDS. Now, what are the pros and cons of this system? When passive reporting system is used, local outbreaks, they may be missed because the relatively small number of cases they often ascertained become diluted within a large denominator of total population of a province or country. However, this system is relatively inexpensive and it is relatively easy to develop initially. Moving on to active surveillance, it denotes a system in which project staff, they are specifically recruited to carry out a surveillance program. Example, the dengue control programs and malaria control programs are there. Significance. They are recruited to make periodic field visits to healthcare facilities such as clinics, primary healthcare centers, and hospitals in order to identify the new case of a disease or disease death from the disease that have occurred. Active surveillance may involve interviewing physicians and patients, reviewing medical records, and in developing countries and rural areas, surveying villages and towns to detect the cases either periodically on a routine basis or after an index case has been reported. Syndromic surveillance, an active or passive system that use case definitions that are based entirely on clinical features without any clinical or lab diagnosis. For example, collecting the number of cases of diarrhea rather than cases of cholera or rash illness rather than measles is known as syndromic surveillance. Significance. Because syndromic surveillance is inexpensive and is faster than the systems that require lab confirmation, it is often the first kind of surveillance which is begun in a developing country. Moving on to the last type, sentinel surveillance. The selected institutions are tasked with reporting on specific diseases. A sentinel surveillance site is a single or small number of health facilities that are responsible for collecting data, monitoring of the rate of occurrence of specific conditions to assess the stability or change in health levels of a population. It is also the study of disease rates in a specific cohort, such as in a geographic area or population subgroup, to estimate the trends in a larger population. It provides data on trends without full-scale population coverage. Now, the data collection and reporting mechanisms include three things: healthcare facilities, population surveys, and disease registries. The healthcare facilities include the mandatory reporting of notifiable disease by clinicians and labs. Population surveys, collection of self-reported health data through questionnaires and interviews are done. And in disease registries, specialized databases that track the incidence and prevalence of the specific conditions, they are present. This is a surveillance system flowchart, which shows the occurrence of health event leading to diagnosis and then leading to reporting sources and then leading to the data recipients, which includes a primary level, including the county health department, secondary level, the state health department, and tertiary level, which is CDC. Components of disease surveillance. These include, number one, collection of data, number two, analysis of data, number three, interpretation of data, number four, dissemination of data. All these four, they constitute the surveillance system, which incorporate into public health action, which includes a priority setting, planning, implementing, and evaluating disease, including investigation, control, prevention. Now, moving on to the collection of data. Definition: the systematic gathering of the health-related information is known as data collection and data surveillance. Disease surveillance. Sources will be hospitals, clinics, labs, and community health workers. Data can include case reports, lab results, and surveys. Now, the types of data. This can be a case-based, individual cases, aggregated, summarized data, or event-based, for example, unusual health events. Now, challenges in data collection includes the completeness, the accuracy, and the timeliness. It can be affected by the resource limitation and reporting delay. Moving on to the second step, which is the data analysis. The definition shows that it is the processing and examining of the data to understand the trends and patterns of a certain disease. Methods include epidemiological methods, such as calculating incidences and prevalence rates, identifying the clusters, and analyzing spatial and temporal patterns. The objective of data analysis is to detect the outbreak of a disease, assess disease trends, and identify at-risk population. Tools that are used are statistical softwares, geographic information system, GIS for mapping, and other analytical platforms. Moving on to the third entity, which is the data interpretation, which is making sense of analyzed data to assess its public health significance. The process includes the interpretation, which involves understanding the context, comparing data with historical trends, and correlating with demographic, environmental, and social factors of a particular disease. Importance of this step is it is very crucial for transforming the data into actionable insights for decision making. Goal is to achieve or to determine the likely cause of the disease, predict the potential spread, and evaluate the severity or risk level of a disease in a certain population. Data dissemination. It is also very important. It includes the sharing surveillance findings with relevant stakeholders. The audience will be public health officials, healthcare providers, policymakers, and sometimes the general public. Format include reports, alerts, bulletins, dashboards, or press release. The frequency, it can be done in routine, like weekly, monthly, or in cases of urgency, for example, as in case of outbreak situation. Objective is to ensure timely information which reaches those who need it to take preventive or control measures. Now we get a response after these 4 steps, which is defined as the public health actions taken in response to surveillance findings. We have an immediate response or we have a late response. In case of an immediate response, the initiation or isolation or quarantine or outbreak investigation, if a disease poses a significant threat. These are included in the immediate response. However, preventive actions can be taken like vaccination campaigns, public health education, vector control. These are the long-term interventions. So policy updates, resource allocation, and capacity building, they're also included in the long-term interventions. Coordination, effective response often requires coordination across different levels of government and international agencies. The goal of response is to contain the disease, mitigate its impact, and prevent the future outbreaks. Now, what are the uses of disease surveillance in public health? Number one is it assesses and monitors the public health problems. Number two, it estimates the magnitude of the problem. Number three, it is useful in setting priorities to facilitate planning. Number four, portray the natural history of a disease. Five, detect the epidemic or define a problem. Six, generate hypotheses, stimulate research. Seven, evaluate programs, control measures. And eight, detect changes in health practices and services. Now, the disease surveillance systems, the World Health Organization surveillance system, Global Outbreak Alert and Response Network, GORN, a network coordinated by WHO to support international outbreak responses, providing rapid response capacity and technical expertise. Global Influenza Surveillance and Response Systems monitors and analyzes the global influenza activity and is central to flu vaccine strain selection each year. International health regulation, a legally binding agreement between 96 countries to prevent and respond to public health threats that can cross borders. So these are the examples of certain international disease surveillance systems. Now moving on to the regional surveillance systems. Number one is for Africa, an integrated disease surveillance and response, IDSR, is present. It is a regional framework developed by WHO in African regions and the CDC for strengthening surveillance and responses in African countries. We have an Asia Pacific strategy for emerging disease and public health emergencies, APSED. It is a regional strategy by WHO for the Asia Pacific regions to strengthen national public health systems with a focus on early detection, risk assessment, and response to public health emergencies. And similarly, we have an European Center for Disease Prevention and Control, ECDC, which provides integrated disease surveillance and risk assessment for European Union countries, focusing on communicable diseases. We also have a national surveillance system. It operates a disease early warning system, DEWS, that monitors priority infectious diseases and outbreaks across Pakistan. It provides data for action, supporting response to disease outbreaks, including polio and dengue program. In polio surveillance program, the purpose is a specialized surveillance program aimed at eradicating polio virus in alignment with a global polio eradication initiative. And for dengue surveillance program, the purpose is a national initiative to monitor and respond to dengue outbreaks with real-time data collection of dengue cases. There are certain challenges which we are facing in disease surveillance. Number one is globalization and rapid disease spread. High levels of international travels and trade, they can rapidly spread infectious diseases across borders, making containment challenging. Then we have crowded urban environment facilitation, which facilitates the faster disease transmission, complicating surveillance and control measures. Another challenge is emergence of new and re-emerging diseases. Emerging infectious disease like COVID-19 and Ebola present unique surveillance challenges, especially in detecting outbreaks early. Similarly, diseases previously under control like tuberculosis and measles, they are re-emerging due to factors like vaccine hesitancy and drug resistance, requiring continuous and adaptable surveillance. So, certain other are antimicrobial resistance, mentioned before. Surveillance for drug-resistant infections is complex and costly, often requiring sophisticated lab facilities and skilled personnel. Data privacy and ethical concerns. Surveillance requires personal health data, which can raise privacy concerns, especially in sensitive cases like HIV and AIDS or mental health. Human resource limitations. This is also a very important challenge. Surveillance requires trained epidemiologists, data scientists, and lab technicians. Many regions face shortage of such personnel. High pressure environments, especially during pandemics, can lead to burnout and high turnover among public health workers, impacting surveillance capacity. Now, role of technology in disease surveillance. Technology plays a transformative role in modernizing disease surveillance, making it faster, more accurate, and responsive. We have electronic health records, EHRs. These electronic health records, they allow for automatic and real-time data collection from healthcare providers, enabling rapid reporting and minimizing delays. Then we have a mobile health application, mHealth. These mobile health applications, they allow healthcare workers and even the public to report symptoms, helping detect outbreaks early. We have a geographic information system, which includes spatial mapping. GIS technology allows for precise mapping of disease cases and spread patterns, helping public health officials identify hotspots and allocate resources effectively. And we have risk mapping. By overlaying environmental and demographic data, GIS can also help predict where outbreaks might occur based on climate conditions, population density, and other risk factors. Then we have an artificial intelligence and machine learning. It has also a role in dynamic disease surveillance. AI models, they can analyze historical and current data to forecast outbreaks, helping public health agencies take preemptive action. Then there is genomic surveillance. Advances in genomic technology enable quick sequencing of pathogens, COVID-19 and Ebola, helping track mutations and understand how disease spreads. Then we have a digital dashboards and public health portals. Public health agencies now use dashboards like WHO and COVID-19 dashboard to visualize disease trends, making data accessible and transparent to public and stakeholders. Portals also help keep the public informed, building awareness and encouraging participation in surveillance activities like reporting symptoms or vaccination updates. Moving on to the recent updates, strengthening global health security by improving disease surveillance in remote rural areas of low income and middle income countries. The COVID-19 pandemic has underscored the need to strengthen national surveillance systems to protect a globally connected world. In low-income and middle-income countries, zoonotic disease surveillance has advanced considerably in the past 2 decades. Limited disease surveillance in remote rural areas is a crucial gap in global health security. Practical solutions on how to implement surveillance efficiently in these resource-limited and logistically challenging settings have yet to be discussed, from simply highlighting the need for a more holistic approach to disease surveillance to a solid plan for how this outcome might be achieved. Inadequate surveillance in remote rural areas can cause delayed detection and ineffective response to disease outbreaks, increasing the risk of pandemics due to latent amplification, regional and global travel, and animal trade. Advances in diagnostic testing, along with the adoption of a One Health approach that fosters collaboration between human, animals, and environmental sectors, can make zoonotic disease surveillance in lower middle income countries more accessible, cost effective, sustainable, and connected across geographical scales. Another article is Artificial Intelligence and Public Health, the Potential of Epidemic Early Warning Systems. The use of artificial intelligence to generate automated early warnings and epidemic surveillance by harnessing vast open source data with minimum human intervention has the potential to be both revolutionary and highly sustainable. Several current epidemic intelligence systems include ProMed Mail, Health Map, Epidemic Intelligence from open sources, Blue Dot, Metabiodata, the Global Biosurveillance Portal, EpicPeer, and EpiWatch. AI enablers early identification and intervention, allowing the early management of newly emergent epidemics to feasibly result in eradication. So the key features are rapid intelligence drawn from open source data to generate higher level and earlier epidemic alerts compared with the traditional surveillance without the need for human reporting. These alerts can be followed up with formal investigations and traditional surveillance methods, such as lab confirmation by public health authorities. Number 2 is the capability to rapidly and globally identify key serious syndromes that may result from new emerging infections or biowarfare events. And number 3 is the ability to address the issues of censorship of reporting and reliance on human reporting and the challenges faced by weak health systems. Moving on to the multiple choice questions. Number 1 is, Pakistan is facing a surge in the cases of tuberculosis. It is ranked as the 5th highest TB burden country. Dr. Ali, a healthcare worker, is working in New Hospital, Lahore. He is required to report the cases of tuberculosis by law. This is an example of which type of surveillance? Alpha, syndromic surveillance, beta, active surveillance, Charlie, sentinel surveillance, delta, passive surveillance, eta, risk-based surveillance.
D, passive.
So the correct answer
D.
is delta. Yes, delta is the correct answer, passive surveillance. Number 2 is Mayo Hospital is a large tertiary care government hospital in Lahore, has been selected by the health department to regularly report cases of dengue fever, measles, and influenza. The hospital does not cover the entire population of the city, but provides consistent and detailed data on these diseases to monitor trends and detect outbreaks. This is known as alpha syndromic surveillance, beta sentinel surveillance, Charlie passive surveillance, delta laboratory surveillance, eta active surveillance.
Beta, sentinel.
Yes, beta sentinel surveillance is the correct answer. A hospital in Lahore has implemented a system to rapidly detect flu outbreaks by analyzing real-time data from emergency room visits, patient symptoms, and pharmacy sales, all without waiting for the lab confirmations. This approach helps in early warning and quick public health response. What type of surveillance system is being used in this scenario? Alpha passive surveillance, beta syndromic surveillance, Charlie active surveillance, delta sentinel surveillance, eta field surveillance.
Beta.
The correct answer is beta syndromic surveillance, as we are relying on only the symptoms and not on the lab results. So this is the key point here. MCQ 4, the district surveillance unit in Lahore receives weekly reports of notifiable diseases from various health
Beta.
facilities. However,